All right. Welcome to episode 36. I hope that you got some time to listen to that podcast we did for Veterans Day. I've gotten some positive feedback on it, and personally, it was probably the most favorite podcast, most favorite, and my favorite podcast to do. So, thank you again to Jeremy for coming and sharing his experience with us. We're forever in gratitude and in debt for that. So, and I hope you guys listened to that and enjoyed it. Today, I want to talk about something that came into the news, I think, early last week, um, where we've heard of in the past that we talked about where the FDA removed the black box warning off of testosterone products that were stating that testosterone could cause heart disease, and so that got removed. The FDA has recently removed the black box warning on women's hormone replacement therapy. So menopausal hormone therapy medications like estradiol and estrogen and progesterone and progestins. So with this is the menopausal hormones, hormone replacement, bioidentical or otherwise, for women to include estradiol, progesterone. Now, unfortunately, women are still left in the lurch and the dark as it comes to testosterone, as there is no FDA approved product for women to improve their testosterone. However, we can use compounded products for that. Some doctors are using commercially available products that are for men at much smaller doses. I think that's potentially fraught with issues with potential overdosing, but yeah, to each his own, and that's why we call it the art of medicine, because we're all going to stroke the canvas a little bit differently, but hopefully all end up with a beautiful work of art. So I did want to talk about this article that I had pulled up. Was There's been probably 1,000 of them since the FDA removed this black box warning, but this is the first one I pulled up, and I thought it was pretty good. So the article is from Stat News, and it's entitled "FDA Reverses Decades Old Warning on Hormone Therapy Products for Menopause." Um, so basically, they reversed the 2003 decision that put a stringent warning on hormone therapy products for menopausal women, saying that treatments offer heart, brain, and bone health benefits. So that's what we're saying now. The commissioner of the FDA, Dr. Marty Makary, wrote the Wall Street Journal op-ed that the FDA is removing the black box warning labels from all combined estrogen, progesterone, estrogen only, and other estrogen containing and progesterone only products for use for hormone therapy. Uh, so basically, the products were specifically mentioning cardiovascular, dementia, and breast cancer risks. Now, folks like me who have been studying and applying hormone therapy for nearly 20 years, and really digging down into the evidence-based medicine, knew all this was nonsense when they were saying that the hormone therapy could cause these problems, and it was just perplexing as how they were coming up with these ideas. Even the data from the Women's Health Initiative, where a lot of this came from, was misread and misinterpreted. Because when you look at that data, the women who got estrogen only had a reduction in risk of breast cancer. When you gave them a fake progestin, then the breast cancer risk went up. Yet everybody kept saying it's the estrogen that's causing breast cancer. And every single study, when estrogen is given to women without a progestin, the risk of breast cancer goes down. The only time it goes up is when a progestogen, as it said in this article, is added, not micronized progesterone. Now, there are some newer progestogens that do not increase the risk of breast cancer. However, I can't speak to them very well because I don't use them. I try to use bioidentical hormones. Now, bioidentical hormones aren't for everybody, and some women may benefit from a progestogen and as far as I'm concerned, in our practice, at this juncture, I would have them find a provider that was willing to prescribe that, because I think that those are still fraught with potential issues. I remember the old commercial for margarine back when I was a child. Is, you can't fool Mother Nature. Um, so anyway, um, the the risk for cardiovascular, where they came up with that is because there was a subset of women that were greater than 10 years post menopausal, and they had a greater propensity for heart attacks after starting hormone replacement therapy. Um, and then they kind of confabulated that data and just blanketly stated that the hormone replacement therapy increased risk for heart attacks and strokes. And these women that had been postmenopausal for 10 plus years did have an increased risk for both heart attack and stroke that actually dropped after the first year of therapy. And they didn't report upon that. And I think that was a mistake as well, because it shows that, initially there was an increased risk, but after a year, that risk dropped to the same risk that a woman um, that was going into menopause without a 10-year absence of hormone would have. And what is that risk, you might ask? It's a 50% reduction in the risk for coronary artery disease in a woman who um, starts hormone replacement therapy before 10 years being in menopause. I like to keep it under 7 years, but um, and and then evaluate a patient who's been 7 plus years without hormones to see if I think that they're at a greater risk for coronary artery disease. And if they are, we'll discuss that, because I think it's a fair discussion to have. And this is called informed consent. Um, so, kind of back to this article, I think it was a great article with, this is Dr. McCary wrote, these labeling revisions signal a meaningful shift toward more nuanced, evidence-based communication of hormone therapy risks, one that prioritizes clinical relevance, distinguishes between different formulations and patient populations, and balances the negatives to reflect both safety and therapeutic value. Because basically, I was just coming into medicine when the Women's Health Initiative came out, and the way that they misinterpreted the data scared a lot of doctors. And I was working with a primary care physician down in Tempe, Arizona, and it was a female who was at or around menopause age, and it scared her. And she said, "We're no longer prescribing this." And I was kind of shocked. But at that time I think it was a first year resident. I was in my internship year. I didn't know enough about medicine, and I didn't really have time during that time to read the article myself. But then I joined organizations such as the A4M, the American Academy of Anti-Aging Medicine, and later on, oh boy, the Age Management Medical Group, AMMG. And and I've gone through some different iterations of some of these organizations that I've joined, and they were kind of shouting from the rooftops that this data is flawed, or not. Was The data wasn't flawed, the interpretation of the data was flawed. And so I had an early exposure to that, but it's been an uphill battle for practitioners like myself for the last 20 years. And this um, reversal is just wonderful, because now women are going to be able to more easily get the treatment and therapy that they deserve and should have. And hopefully there's more doctors now that will be open-minded to it. But unfortunately, in my profession and healthcare, we have a lot of confirmational bias, and physicians refuse to reverse their position, and they want to hold steadfast to it. And it just doesn't make sense to me. Science is not a thing. It evolves. It's not some one thing. We found this and it's true, and it's true forever. We continue to evolve in science, especially in the biological sciences. So, I welcome my fellow healthcare practitioners that are not well versed in hormone replacement therapy to start opening your eyes and your minds to understand the safety of these medications and the benefit and long-term health benefit for our patients, because your confirmational bias can be harming a patient by basically stealing their ability for longer, healthier lives by refusing them hormone therapy. Now, there are some women that probably shouldn't have it, and I can argue that side too, but this is not the platform that I want to do that. Um, I'm just going to go kind of go through this. You know, this was going back to that 2002 landmark study, the Women's Health Initiative, that came with the increased risk of heart disease and breast cancer. And I explained that to you. Study specifically focused on combination therapy among older postmenopausal women, but the results were interpreted broadly, ultimately driving down rates of uptake for the therapies. Since then, a growing body of research has shown that hormone therapy can actually be beneficial to menopausal women's heart health, reducing insulin resistance, and improving other cardiovascular biomarkers. These therapies can be used to alleviate menopausal symptoms, including hot flashes, sleeping troubles, vaginal dryness, and painful sex. You know, the latter part, or what we call the vasomotor symptoms, those are the short-term benefits, but the long-term benefits are the reducing the risk for metabolic disease, cardiovascular disease, um, in bone health and brain health. Those are the long-term benefits that we want. Um, Many clinicians have advocated the FDA to remove the black box warning from hormone replacement products, focus largely on vaginal products like topical creams or a ring, where hormones are not fully absorbed into the person's bloodstream. So for women that have a history of breast cancer that is hormone sensitive, and doctors are hesitant to put them on any hormone therapy. The data is very strong now that intravaginal application of estradiol with a vaginal cream, suppository, or vaginal ring does not go systemically. It will not have a negative impact on their breast cancer, and it can help rejuvenate that vaginal tissue because it is very hormone dependent. On top of that, it reduces a woman's risk for urinary tract infections. I actually heard on one podcast, and this is something I've thought for a long time. It was funny to hear it from another physician, female. I believe she's a GYN, that basically stated Medicare should be almost mandating that elderly women, menopausal women, get a vaginal cream or suppository by their primary care provider, because the reduction in urinary tract infections, because if that vaginal tissue is healthy, the risk of urinary tract infections goes down. And if any of you are healthcare providers, you'll remember being a resident and working in a hospital, and having those older female patients with urosepsis, and this could have been prevented, or the risk of it greatly reduced by the use of vaginal estradiol, or vaginal estrogen, period. And I always want to make the point that when you read our articles, when they say estrogen, they are meaning, something besides estradiol. It could be included estradiol, but generally when the study is done on estradiol, it specifically states estradiol, which is the bioidentical form of estrogen that's the primary hormone that the ovaries produce. When they say estrogen, a lot of times they're talking about conjugated equine estrogens like Premarin, which stands for pregnant mare urine. So I think that's important. The other side of that is when you read an article, if they say micronized progesterone, they're talking about micronized progesterone. When they say a progestin or a progestogen, they're probably talking about some man-made substance to replace the micronized or the natural progesterone. This line here was great. Vaginal products are categorically safe for all women, period. An internist, Heather Hirsch, added that she believes the warning on systemic hormone therapy are broad and poorly defined. So back to my point I said earlier, science evolves, and so must our warning labels, said another physician, Rachel Rubin. And according to the officials in JAMA, commenters reported relief with local vaginal estrogen and asked for labeling to be changed. ACOG, the American College of Obstetrics and Gynecologists, has long shown support for reevaluating the label on local estrogen products. But in a comment submitted to the FDA in September, the organization strongly encouraged the agency to host a formal advisory committee meeting. The group also recommended an entirely separate process take place regarding systemic therapies. In a statement Monday, ACOG commended the FDA for its action. When asked at a press conference Monday why the agency decided not to host an advisory committee meeting, Dr. McCary said it was because adcoms and bureaucratic, long, often conflicted, and are very expensive. It remains essential that women are fully informed about the overall risks versus benefits. Rousseau and Anderson, the lead authors of the Women's Health Initiative study, wrote in a statement, because their study got blown up and they misinterpreted their data, and so they want to kind of save face, maybe. I don't know. Researchers don't have an official position on the black box warning, but they noted that there have been no large randomized trials in the years since their work. This information given should be based on the most rigorous science rather than anecdotal evidence. I'm sorry, but this is not anecdotal evidence. There's been plenty of studies, and even your own data showed that you misinterpreted it. So you wrote the paper, couldn't even understand your own data, and now you're still trying to save face. Come on. I mean, you guys should just really give up writing articles and writing for medical literature. It's been 23 years and you still can't say, oh, geez, we made a mistake. I think that's, well, I don't have to be politically correct. That's piss poor. And that's why we have people doubting medicine. We have a hard enough time because of the debacle in public medicine, trust secondary to COVID and the misinformation that came out there, and the double messaging and all kinds of negative issues that come out to COVID itself, the vaccines, whether or not to wear a mask. Can all be debated, but we know that there was a lot of misinformation, and it wasn't, it was on both sides of it. It took an issue that should have been left for the medicine and public health and made it political, which was a damn shame. I don't want to continue down that pathway because it just does nothing but upset me. I want to keep focused on this. While the black box labels are coming off, the therapies will continue to include adverse event information, taking a more tailored approach to each therapy. This makes sense. This is, again, called informed consent. So there are things that can go awry, but it's an individual basis. Experts widely agree that it's best to initiate hormone therapy under age 60. Safety data will reflect the specific known risks with each treatment type, as estrogen alone can have different effects than estrogen and progestogen combined. The FDA conducted drug utilization analysis to characterize prescribing patterns and the extent of hormone therapy use among menopausal and postmenopausal women. All politics aside, we're excited for this. Said Monica Molnar, the co-founder and CEO of Ally Health. She's worried that the public trust in federal health agencies dips under the current administration. Some people may be suspicious of the change. This really needs to be seen as a great thing. Let's not pick a side. The public trust in health dropped under the previous administration. Some people have less trust under this administration. So politics should not be a part of this. So that's just kind of a review of this piece of literature, and it was poignant today, especially because my last patient was a patient of a long-term, as a wife of a long-term friend of mine, and she has been postmenopausal for 5 years and suffering with the effects of being postmenopausal. And it was my absolute pleasure to see her today and give her hope that, some of the things that she's been dealing with can be addressed with proper bioidentical or even just other hormone replacement. But here at Ages Forever, we focus on the bioidentical, giving back the body the exact hormone and the exact biochemical structure that their body was producing. And so for this particular woman, you know, she had gained a bunch of weight. Her body fat percentage is almost 45%, and she basically didn't recognize herself anymore. Uh, she was placed on cholesterol medications. I see this all the time with women coming in menopause. Their whole life they had normal cholesterol, and then all of a sudden they go into menopause and they have high cholesterol. Well, cholesterol medication will correct that, but if you gave her back her hormones, that would have corrected her not only her estradiol and her vasomotor symptoms, but it corrected her cholesterol and reduced her risk for heart disease. So, you know, just using a medication isn't going to help the overall, right? She was also placed on an antidepressant. She had a lot of things go on when she went into menopause. Both her parents passed away at the same time she was going into menopause. So maybe that antidepressant was indeed needed for a short term, but this is 5 years down the road and she's still on it. She's deathly afraid to come off. Well, a lot of the therapy for menopause, after we bastardize hormone replacement, was, well, then just put them on an antidepressant. So now she's on two drugs, a cholesterol medication, an antidepressant, oh yeah, and a blood pressure medication, three drugs that she shouldn't be on, more than likely, if she was put on hormone replacement therapy at the right time. And so our goal with this patient is, number one, let's get her hormones balanced. Number two, let's get her weight down. And she had, a significant amount of visceral fat. And we covered on a previous podcast the difference between visceral and subcutaneous fat and why visceral fat's more dangerous and creates more inflammation. So we're going to focus on getting rid of that visceral fat, and the subcutaneous fat will come down with that. We want to be off of blood pressure medication. We want to be off of cholesterol, statin medications. We want to titrate down and hopefully get off of antidepressant medications. And just really, at the end of the day, as I explained to her, we're not giving you any medication. I'm giving you, yes, there's pills and creams, but they're just replacing the hormones that you're incapable of producing. I'm just giving your body back what it was missing. So I don't personally view bioidentical hormone replacement as medications. It's, I don't think insulin is a medication. It's a hormone. So when you give a type 1 diabetic insulin, it's because they cannot produce it. So, but that's the kind of gist of today. I know you ladies out there don't like to hear a man pontificate about female health and hormones. I was going to have one of my nurse practitioner or PAs come in and speak on this, but I feel so strongly and passionate about it that I wanted to address it myself. And especially after having my patient today, I'm so excited that we're able to continue down the path of health with this individual, and I'm so excited to see what she feels like and looks like 3-6 months down the road, because I feel very confident that when she looks in the mirror, she's going to see a person that she recognizes and missed over the last 5 years. So with that, thank you for your time. If you guys you're out there, you have questions, you're interested in bioidentical hormone replacement, you're a woman that is in perimenopause, menopause, please reach out to us. Be happy to answer your questions. If your doctor is afraid or incapable or unwilling, uncomfortable to treat you with hormone replacement in a proper manner, please reach out to us. We've got, female practitioners, and if you don't want to see me, and we're happy to help you, and we would look forward to helping you improve not only short-term, but your long-term health and longevity. Thank you.